Hello everyone. So today we'll discuss the most important topic of pathology, that is the viral hepatitis, in a very easier manner. So first of all, what is viral hepatitis? It is basically the inflammation of liver parenchyma which occurs due to the hepatitis virus or Epstein-Barr virus and the cytomegalovirus. Now let's go in brief about the hepatitis virus. First of all, we have the hepatitis A virus, which is transmitted by the fecal-oral route, and it is very common among the travelers, and it causes the acute hepatitis. Hepatitis E virus is also transmitted by the fecal-oral route and transmitted via the contaminated water and the undercooked seafood. Again causes the acute hepatitis. Hepatitis B virus is the most common one, transmitted by the parenteral route, transmitted during birth, unprotected sex, or by the needle prick injury. Hepatitis C virus is again by the parenteral route, and hepatitis D virus is dependent on the hepatitis B virus for the infection, causing the superinfection. Now let's again move on to the hepatitis. So the acute hepatitis, if untreated, progresses towards the chronic hepatitis. And in the acute hepatitis, the symptoms last for less than 6 months, while in the chronic one, it lasts for more than 6 months. Now the inflammation. Now hepatitis means the inflammation of the liver. So in the acute hepatitis, there is inflammation of the lobules of the liver and the portal tract, while in the chronic hepatitis, there is predominant portal tract inflammation is involved. Now very important, the symptoms in the acute hepatitis. So the very common symptom includes the right upper quadrant pain. There will be pain in the right upper quadrant and also the nausea and the vomiting. Jaundice is the most common complication in the acute hepatitis. Now in the jaundice there is mixed type, that is the conjugated as well as the unconjugated bilirubin jaundice, which includes the pruritus with dark colored urine, okay, because of the conjugated bilirubin, and also clay colored stool is seen. And over here the liver enzyme, that is the ALT and the AST, are also elevated. Over here the ALT is more elevated than AST. So these were the complications in the acute hepatitis. Now symptoms involved in the chronic hepatitis. So over here, fever, fatigue, decreased appetite is commonly seen. And if this chronic hepatitis is not treated, then it may lead to liver cirrhosis, which is the final stage of liver damage or liver injury. We'll discuss about the liver cirrhosis in detail in my further video. Now let's move on to the very important subtopic, that is the pathological scene in the acute hepatitis. So over here, first of all, this is the portal tract. Okay, and in the portal tract, these structures over here, you are looking at, it is the inflammatory infiltrate. Okay, as because this is the inflammation of the liver. So over here, these are the inflammatory infiltrates. Now this structure looking at, it is the bile duct reaction. Bile duct reaction is recognized as the bile duct hyperplasia. Hyperplasia occurs over here because of the liver injury. Okay, and it is characterized by the proliferation of the reactive bile ducts induced by the hepatic injuries. Now somewhere near and around the portal vein, this is the portal vein, right? Somewhere near around this portal vein, you will see the periportal necrosis. Periportal necrosis, that is the necrosis of the hepatocytes near or around the portal vein. Now this is associated with the ingested toxins. Now next, the very important characteristic feature of the acute hepatitis, it is the ballooning degeneration. Very important. Now as the name suggests, ballooning, that means the swelling and the rounding up of the hepatocytes in the acute hepatitis. Now what causes this ballooning degeneration? Now there are two possibilities. It may be caused by the membrane damage of the hepatocytes, which allows the influx of the fluid into the cell, leading to ballooning degeneration, or it may be because of the damage to the cytoskeleton, leading to the loss of cell shape. So these may be the reason of the ballooning degeneration in the acute hepatitis. At various locations, you will find the apoptosis in the acute hepatitis. Now also because of this viral infection, what happens, there is macrophage aggregation seen at various locations in the acute hepatitis in the liver. Also because of the viruses including the HIV, hepatitis, cytomegalovirus or Epstein-Barr virus, what happens is there is inflammation or the scarring of the bile duct occurs, and because of this there is reduced flow of the bile, which may lead to cholestasis. Also in the acute hepatitis, in some of the cells there may be seen fatty changes. It is not seen in this diagram, but in the acute hepatitis, in some of the cells, because of the hepatitis C virus HCV, in some hepatocytes there is fatty changes seen. So again, let's discuss in brief about the clinical features, the pathological clinical features in the acute hepatitis. So first of all, we have the inflammatory infiltrate over here. Then next we have the bile duct reaction. We have the periportal necrosis near the portal vein. Then the fatty changes over here somewhere because of the hepatitis C virus. Then we have the apoptosis at various locations. Now very important pathological feature, that is the ballooning degeneration. The cell will swell up. Okay, and the reason may be membrane damage or the damage to the cytoskeleton, which lead to swelling up of this hepatocytes, leading to ballooning degeneration. Very important pathological feature. Now next we have the cholestasis, the reduced flow of the bile, and the macrophage aggregation. So now let's move on to the pathological features in the chronic hepatitis. So first of all, over here you can see this is the inflammatory infiltrate, dense inflammatory infiltrate. Previously, if you remember, we were having the scanty amount of inflammatory infiltrate in the acute hepatitis, while in the chronic one we will be having the dense inflammatory infiltrates. Now, very important pathological feature of the chronic hepatitis, it is the bridging fibrosis, as the name says bridging. So, it bridges between the portal and the central vein. Now, this bridging fibrosis occurs after the central lobular necrosis, and this produces new vascular connections between the portal field and the central vein, which may lead to cirrhosis. So, it is basically occurring after the central lobular necrosis. This may be the reason for the liver cirrhosis, and that's why we say that the after chronic hepatitis, if the chronic hepatitis is untreated or uncontrolled, this may lead to liver cirrhosis. Now again over here you will see the portal fibrosis, periportal necrosis around this area. Okay, now again a very important pathological feature in the chronic hepatitis, it is the ground glass cells or the ground glass hepatocytes, which are caused by the hepatitis B virus. Now, first of all, what is this ground glass? So, as you can see in this picture, these glasses are known as ground glass, in which you can't see through these glasses. They are very opaque. So, you can't see through these glasses. They are known as the ground glasses. So, in the chronic hepatitis, there is ground glass appearance of the hepatocytes. Now, why are these cells known as the ground glass cells? Because under the light microscope, such liver cells have the eosinic granular and the glassy cytoplasm. Because of the glassy cytoplasm, such hepatocytes are known as chronic hepatocytes, and these are seen under the light microscope, having the glassy cytoplasm appearance, known as the ground glass cells, caused by the hepatitis B virus. Now over here also you will see the apoptosis, and over here you will find the lymphocytes and the macrophages also. Now also fatty changes by the hepatitis C virus. So these were the important pathological features in the chronic hepatitis. Now let's discuss in brief regarding the pathological features of the chronic hepatitis. So first of all, we have the dense inflammatory infiltrate over here. Then next we have the very important, that is the bridging fibrosis, that is the vascular connection between the portal and the central vein, and this may be the reason for the liver cirrhosis. Now the periportal necrosis and the periportal fibrosis around here. Then we have the ground glass cells. The hepatitis B virus basically causes this type of ground glass hepatocytes in the chronic hepatitis. Then we have the various apoptosis area over here, macrophage aggregates and the lymphocytes, and the fatty change because of the hepatitis C virus. So yeah, this was about the viral hepatitis, acute and the chronic one. I hope you found this video helpful. We'll discuss about the cirrhosis in my next video. Thank you so much.